in this congressional district alone who are not going to be able to benefit from the consumer protections of the Affordable Care Act, and that's things like having a medical loss ratio to keep premiums under control, having preventative care. So maybe Congressman Dold wants them to take some Bayer aspirin for their headache. Somewhere between 9,500 and 97,000 seniors in this district who are now going to be able to get help under the donut hole, who now can go into their doctor and get preventative care like mammograms and other checkups. So maybe Congressman Dold wants to make that one Wednesday to not vote to repeal the Affordable Care Act, to stand up for the people of his district.
My name is Andrew Kurtz. I'm a former Senior Vice President and CFO of Blue Cross Blue Shield of Wisconsin. The Supreme Court has ruled the Affordable Care Act is the law of the land. It is not perfect, and it certainly can be improved. But enough of this repeal nonsense. And what is this silly nonsense that the Massachusetts individual mandate works only at the state level? Preventing an uninsured freeloader from shifting costs to the insured is the same, no matter what state you are in. Besides, Republicans for many years were for a federal mandate before they were against it. Yet your zeal to repeal not only throws out reforms that affect over 200,000 folks in District 10, but also more than 80% of the bill, of which you know little about. So why don't we look at the baby you threw out with your bathwater? Well over half of the bill addresses critically and sorely needed reforms to government programs like Medicare and Medicaid. Already, thousands of doctors, hospitals, and others around the country are setting up accountable care organizations, an outstanding reform that for the first time brings accountability to Medicare. This business model, essentially practiced by exceptional providers, will bring the same increased quality and lower costs to the entire population, not just to Medicare. Another section addresses the impending scarcity of healthcare providers, adding to the supply of primary care doctors and nurses that will be in short supply. These important workforce reforms will bring more care to rural and underserved areas. Is it wise to undo all these reforms to satisfy your gripes about one part, even though most people favor the specific benefits that part provides? Congressman Dold, it's time to move forward. Thank you.
My name is Lynn, and I have a pre-existing condition. And if anything happens to the health care insurance that I have now, which is excellent, it's employer-provided insurance, I won't be able to get insurance again, ever. Now, the 1st of January of 2014, this will all change, thanks to the Affordable Care Act. But in 2003, I almost lost health insurance forever. My husband was laid off, and the company he worked for was a small business. It didn't have enough employees to qualify for COBRA, so that was not an option for us. The not-for-profit organization I worked for simply did not have the money to provide health insurance for all its staff. It only provided insurance for the executive director. So I was in a situation where I've got to get coverage right away, because if I go one day without medical insurance coverage, I won't ever be able to get it again. And so I told my boss what was going on, and I said, how about if I pay out of pocket the full premium for the coverage for our family until my husband gets another job, and we go with the health insurance that you got. And he, being a really great guy, agreed to that. And he talked with the board of directors. So I had to pay for the full premium until my husband got another job. And I had to pay that out of pocket. It's ridiculous. I didn't even have a claim to make during the time period before he got another job. But I had to pay this huge amount out of pocket just to make sure that my coverage was uninterrupted. So now the Republicans want to eliminate the ACA before I even benefit from it. And I don't appreciate that. I think we need to let Congressman Dold know that we are watching what he's doing. And we know that he's trying to undermine ACA, and we know he's trying to repeal it, which is all wrong for the 10th District. We we need to let him know we're watching and we don't like what we're seeing. We have been working for 3 or 4 years in support of the Affordable Care Act. So we were working really before the law even came into shape.
Yeah.
And we are continuing to support the Affordable Care Act. And we are concerned, since Congressman Dold is representing us, we want to know what his position is on the Affordable Care Act.
Yeah.
Will he be voting tomorrow for it or against it?
He has voted for the repeal before, and he will vote for the repeal.
Again?
That is not what we want to see happen, Mary.
So,
We do not want it to be repealed because there are so many people in the 10th district,
Really? What are you gonna
including
do?
many of us, who are helped tremendously by the Affordable Care
my
Act.
daughter needs her insurance.
Um,
Thank you.
I want to give you this little packet of stories from people in the 10th district
Thank you.
about how the ACA is helping them. I don't think my story's even in there, but we would really like for you to communicate to the congressman that his constituents want him to support ACA and stop voting for the repeal.
Okay.
We would like him to leave this alone. The Supreme Court has okayed it. Congress voted for it. The president signed it. It is the law. We want him to work on jobs for us.
Jobs, yeah.
Not take away
Jobs.
our health care, but work on jobs. Can
There's
you
been-
communicate that to me,
I would be
please?
glad to communicate that.
Okay.
Make a statement so
Yeah.
you can give me your letter too.
He doesn't.
We would like to know
I'd
what,
like
you
to
say
know
he
what he
supports
supports.
parts of ACA. Please tell us what parts it is.
Is it,
Yeah,
They are.
he supports that no one should be denied insurance with a pre-existing condition, for example.
Well, that's the
Okay.
start, but that's
Well,
in
we
the
won't have
care
that.
act.
It's already
So
there.
why are you
Yeah.
going to repeal
Yeah.
something that he likes?
I'm glad that he supports part of ACA. In fact, it's a very important part that hasn't even kicked in yet. So he wants to repeal the whole thing before it's all kicked in. And he's trying to leave us behind, leave us with nothing but Band-Aids, over-the-counter drugs, if we can afford them, vitamins, and toys. And we're not happy about that. We are watching what he's doing. And we just want you to know that we are not happy with what we're seeing from the congressman. We, from the 10th district, support it, and we want our congressman to quit trying to get rid of it. And
Right.
that's pure and simple, that is our message.
I
Is
would be
if you
glad to
want,
pass
if you
it
like
on.
pieces of the bill, fix the bill, fix the law, right? Because there's no way in hell, this is a 100-year battle. There's no way, if he's sincere about the 446,000 people in the 10th district that are now being rewarded from this bill,
We would agree with what you just said, though, by the way.
Well, then don't repeal it.
Don't repeal it.
Don't repeal it.
That's-
Come
that's-
up with solutions and pass those
Yeah.
first.
because we would even
agree
work with
with
him
you.
on, if there was alternatives to the
No,
mandate,
chop
if there
it
was
up.
other things like that, we'd be happy to work with the congressman.
But
Well,
you get that, I would agree with what you just said,
Which was what?
Are you going to skip it back?
that we think it needs to be worked on, agreed on with Congress.
Rather
Any
than
changes,
appeal?
that's
So
right.
any changes, that's fine, but if you
So is
repeal
that
it,
how we need to
if you
vote?
repeal it, you kill a 100-year battle that will not come
I'd like
back.
to pass it on to Congress.
So just make sure he understands, his repeal is not, that means he does not support any part of the bill.
he
Okay.
could put that out in his newsletter.